accident. Back to the Parish Line right now. In an interview with Michael Douglas, published in the Guardian newspaper, now it's creating a lot of discussion this week. Douglas was diagnosed with throat cancer in 2010. Smoking and drinking are the main causes of what they call oral cancer. But as Douglas pointed out in the Guardian interview, it can also be caused by oral sex. Douglas claims that that type of cancer he was diagnosed with is caused by the human papillomavirus, or HPV. Joining us now with details on the link between HPV and oral cancer is Dr. Christy Valentine, coincidentally an old friend of mine, a doctor of mine too. Now let's first of all talk about, it's become a widespread topic of discussion, HPV, because we have learned that HPV causes cervical cancer in women, and there has been a very active campaign over the past few years to prevent cervical cancer, especially with that vaccine Gardasil that was pretty controversial. So compare that to the cases of oral cancer caused by HPV. Are the risks the same?
Well, HPV, or human papillomavirus, as you mentioned, it's a large family of viruses. There are over 100 subtypes. And so the one HPV-16 is the one that is really the high risk form of the virus that is linked to throat cancer.
And that is also the same, well, HPV is the same virus that causes genital warts. I mean, what are some of the other more common?
It can cause an infection in different parts of the body, including the throat and pharynx. And I think that's the part that really got people talking, because a lot of individuals just weren't aware of that. And men actually are the one, they're more commonly affected with the oral pharyngeal infection than women.
Mm-hmm. What's so scary, though, about HPV is that most people who have it don't know they have it, right?
Right. They don't know. And the symptoms can be very subtle if you have any symptoms at all.
If you have any, yeah.
Right. So some patients, they may have a sore throat that's just kind of chronic. They may have a red or a white patch on their tonsils. Their voice may kind of give out on them a little bit. Things that you may want to make contact with your primary care provider to talk about.
And I understand that there's something like 75% of people who have been sexually active have it?
Yes. It's 7% of people ages 14 to 69 can become infected with just the tonsillar form.
Just the, right, okay. Just
absolutely.
Are there any ways to, when we talk about Gardasil and the vaccine to prevent cervical cancer in women, is there anything that men can do to prevent oral cancer, or do you find out often when it's too late?
Well, you know, what we always say is that it's important to practice safe sex measures, because you will come into contact with people that have been infected, especially since it's the most common sexually transmitted disease out there.
But beyond that, is there something you could do specifically? I mean, if you have HPV, and so many people do and don't have symptoms, is there something that the men can do, or the young boys, I guess, who are sexually active, to prevent that possibility, or to catch it early? Because you don't have pap smears in men.
You don't.
You know, clearly,
you don't have,
and that's what you would do for women.
Exactly. You don't have those types of tests in men, and that's why it is important to make sure you have contact with your doctor. Because a lot of times, if something is identified, then you want to treat that particular symptom. As you mentioned, genital warts, you treat that specifically.
Right.
The same as you would if you found a lesion orally. So there is not a vaccine that necessarily can prevent throat cancer, even though they do have indications for Gardasil in boys and men as well.
And you do, oh, right, they do have that vaccine for men now. And you do have to ask your doctor specifically for an HPV test, so I should mention, because that's not included in the pap smear.
No, it's not. And it is something that, you know, we can check for, and checking you for sexually transmitted diseases.
Dr. Christy Valentine, thanks so much for coming on to talk.